Good morning, everyone. Thank you, John, for, I think, that introduction. Sorry about getting a little late. Schlepping from Virginia this morning was a little bit harder than I anticipated, and thank you for the second shot. I know with a different subset of this group, I had a chance, when was it, a couple months back, wasn't it? Was it? Different group, but same subject matter. And I also want to thank Kathy, Mr. Greenlee, for inviting me here today. And let me start by acknowledging tremendous amount of expertise in this room. I wish my day job would not preclude me from spending the whole day here. I know Elizabeth Falcone, who's got some of the information on our legislation, is going to stay for part of the second panel, and we'll have more handouts. But I know you're going to touch on issues all day about from palliative care to chronic pain to issues of advanced illness. What I wanted to touch on and the focus of the legislative actions that I've taken are around this whole question of advanced planning and the kind of shared decision making that I believe should be not only part of every family's discussion, but also part of a long overdue discussion around these topics in public policy. This is not my first foray into this subject. I have been in the Congress for 5 years now, and every congressional session I have had legislation on this subject matter, but probably not unlike most everybody in this room, I come to this not only from a policy-making standpoint, or many of you from a medical standpoint, but every one of us have got a personal standpoint. My family, I think about the fact that my mom had Alzheimer's for more than a decade, and she had parents who all had the same affiliation of the disease. She didn't even speak her last nine years, and prior to being senator, I was governor. And yet, even with all that kind of family history pre-warning, you would have thought, and being a relatively informed citizen, that we would have sat down within our own family and had the kind of conversations when my mom could still weigh in with our pastor and others. And when we didn't, and yet still, my father and my sister, who were her, God bless them, 24/7 caregivers for those last 8 or 9 years, when it came to those moments, there was still a great deal of unease. So, this is something that, to me, is more than policy. It is something that we all know amongst every family. These kind of conversations and discussions inspire more than a little bit of trepidation. This is not a subject that is easily discussed or easily addressed. I remember when I was governor, I had a number of sessions on this, and I would bring together faith leaders and trying to talk about how they could be more involved. And I'll always remember this one. He was an African-American minister at one group, stood up, and I thought he said the best thing I've ever heard from a faith leader on this subject of advanced planning and advanced illness. And he goes, we're pretty good about the life business, and we're pretty good about the afterlife business. We're not very good on that transition. And I thought that was a wonderfully kind of, wonderful statement. And one of the things that has also frustrated me is we've seen, there were lots of frustrating moments clearly in the 4 or 5 years ago on the healthcare debate, whenever it was. But for me, the absolute low point of the debate was when certain political figures started to say that the idea that these kind of conversations ought to be had and that medical professionals ought to be compensated to have these kind of conversations was somehow about limiting people's choices rather than expanding people's choices. To me, it was clearly the lowest moment of the discussion, and as you are again more aware than I, had this effect of basically taking many of our political and policy leaders who had been thoughtful and working on variations on this issue for years kind of sent them to the wind. And only now, 4 or 5 years later, are people being willing to kind of stick their heads and hands back up and say, no, it is time. America, the only major industrial country in the world that has not had this kind of conversation in an adult fashion. And the good news is that I think that kind of ignorant connotations and comments are in the past, and I think there is a growing bipartisan recognition that the time has come to have these discussions again. And so with that in mind, over the last year, with a very good friend of mine, someone who has got similar stories and others, with Johnny Isakson, the senator from Georgia, we have worked together and have introduced legislation known as the CARE Planning Act, which we introduced last summer. It is, at its core, this idea, and my staff and others had to kind of ratchet me back from trying to say, let's take on all issues about, end of life, advanced planning, other things, and they said, no, let's, they convinced me that we need to, at least start the conversation. So the Advanced Care Planning Act is designed to help patients get the care they want, no more and no less. And quite honestly, we try to do this in 4, again, relatively simple ways. And let me acknowledge on the front end, this is not as comprehensive where I think this discussion ultimately needs to go, but in an area where we've not even been able to have legislation get a bill actually ever get marked up or actively into the debate, we think we ought to at least start small, and I think this is what we're trying. What we do is, in the Advanced Care Planning Act, is 4 things. First, we create a reimbursable benefit under Medicare Part B for voluntary care planning for people with advanced illness. Now, what we've tried to do in this, that is, I give a lot of the folks who helped us think this through something that is a bit of a new approach, is that we base this eligibility on a broad definition of advanced illness. But unlike any other Medicare benefit that we know of, the bill uses a measure of fragility that is unrelated to the specific diagnosis to determine the care of eligibility. So rather than trying to drill down on metrics in a specific disease, we use the categorization around fragility. And that we then say, if we're going to provide this benefit, that the benefit ought to be provided by an interdisciplinary team that will be the medical professional, but also have a social worker component that will be able to meet with the family to develop a plan rooted in the patient's goals. So both in terms of definition and the of qualifying for the benefit and the type of team approach we think is put together well. And again, obviously the elements of this process were derived from geriatric and palliative care best practices. Second, recognizing that care planning is just the tip of the iceberg, we also create a pilot program called the Advanced Illness Care Coordination Services. Again, here we, should I not get into kind of the other language that I was real? Yeah. I didn't, as I've learned, as somebody who's been involved in this for some time with Elizabeth and others, so I also have learned, though, that that this is an area that is fraught with, if you use the wrong term, you get yourself in a lot of, so I should stick to script, kind of like, because I don't want to describe this as kind of extended hospice, but the notion of creating a pilot that says, all right, if you've had the conversation and you've got the benefit and you've got it reimbursed, then how do you provide the care that goes along with the plan that the patient and her team have worked out? And so rather than trying to put this out, we start with a pilot that how to best provide wraparound care for those who are seriously ill and frail. It would obviously include medication review, management coordination of care, and in-home supportive services. And again, we know this gets into areas where different providers think it's parts of their different space, so we want to work with you to get this right, to get it tried. Third, and we want to shore up the current system. We don't want to create plans that aren't followed because they can't get into the medical record. We start again with the basic concept that, if you've had this benefit, if you have this plan, and mom moves from Virginia to Illinois to California, that the plan ought to follow the patient, and that, quite honestly, the failure to have plans follow across state lines is an enormous challenge. But we also am aware that, again, this gets into areas that are problematic. So we want to start with a basic premise that says, is the treatment aligned with the patient's wants? And that treatment ought to be aligned with the patient's wants wherever he or she resides at this moment of advanced illness. Fourth, we want to basically create a small amount of dollars for grants to disseminate information about advanced care planning. How do we work in public-private collaboratives to get the word out, to educate groups, faith-based groups, family groups, other groups, that this is part of life. And we ought to have a conversation and be able to talk about it in a way that isn't going to be mislabeled as some kind of a death panel or some other outrageous, spurious claim. And finally, we recognize that we're still at the beginnings from the policy standpoint. You guys are obviously well far along in terms of the medical and ethical and other decisions, but from a kind of congressional policy standpoint, this is just the beginning, and we want to study what happens. This is just the first step. So, we think we've made a very good effort, and my staff and Johnny Isaacson's staff have worked, I think, with almost all of the stakeholders, and we have been very, very pleased with the both support and even from those who, if you raise this issue, might immediately say, hold on here, we have got some of those groups to, at least, they may not be embracing, but they're net neutral, which is a giant step forward, because this is the time, and I am excited about it. I'm very excited about the administrators doing. In my balance of my day job, I am obsessed about an issue of the debt and deficit. You won't get my whole, I promise I won't give you my whole speech on that right now. I think our greatest threat to our national security is not some external challenge, but the $17 trillion in debt that goes up $4 billion a night. And what that does is it continues to squeeze out investments and anything else that we care about. And one of the things that I find, as a Democrat talking to other Democrats is, sometimes the reflexive sense that, we can never talk about entitlement programs. I think Medicare, Social Security, Medicaid are the best programs that any Congress has ever put in place. They desperately need to be preserved. But we also have to recognize that the math around those programs don't work the same way they worked when I was a kid. At that point, there were 16 people working for every one person on retirement. Now it's 3 people working for every one person on retirement. That is a blessing because you and your colleagues have allowed us all to live longer. But living longer means we're all going to live through different stages and phases of life. And to respect my mom or your dad or your aunt or your grandma, through that stage of life of advanced illness, we ought to treat that stage of our life with respect, with care, with consideration, and with acknowledgement that the patient, that he or she deserves a very active role in that phase of life. And my sense is that the Advanced Care Planning Act is a good first step. We are wide open for business on ways to improve, change, but in a year with the president last night saying this is a year of action. Wouldn't it be great if we actually surprised folks and showed bipartisan action on an issue like this in 2014? So Johnny Isakson and I are ready and committed to doing that, and there are increasing numbers. And the other thing, we've had, Bill Nelson had a hearing on aging a while back, and the number of, I can't speak to the House, it's amazing, the Senate and the House work 200 yards apart, and I don't have the foggiest idea what's going on at the other end of the hall. But in the Senate, there are an increasing number of senators of both parties who realize that this is an issue whose time has come. Lord knows everybody's got a family story. I thank you for what you do. I apologize again for being a little bit tardy, and I'll get off the stage and let you get back to the order of the day. Thank you all very much.